Hello student, today we are going to see about the dura matter. So what you see, this is dura and this is endosteal layer of dura, and inside we have towards brain is the meningeal layer. Now at the skull cap, endosteal dura is attached, and from both the side meningeal layer unite to form a fold, which is this fold called as falx cerebri. This falx cerebri is having anterior attachment and posterior attachment, superior border and inferior free border. So in the superior border of this falx cerebri, which is sickle shaped fold, is having superior sagittal sinus. This is superior sagittal sinus. This anterior attachment is to this crista galla. This is crista galla and this is frontal crest. These gives attachment to anterior part of falx cerebri. Now posterior attachment of this falx cerebri is to this tent like tentorium cerebelli. Now this tentorium cerebelli is attached here to the petrous part of temporal bone and to the occipital sulcus behind and to the internal occipital protuberance. This tentorium cerebelli, it is having, this is tentorium cerebelli, which is attached like this. Now it is having attached margin, and this is free margin. This is free margin of tentorium cerebelli. Now free margin is attached here to the anterior clinoid process like this to form tentorial notch, and attached margin is attached to petrous part of temporal bone and occipital sulcus, internal occipital protuberance. This is attached margin. This attached margin posteriorly attached to posterior clinoid process, and free margin of tentorial notch is attached to anterior clinoid process to form this tentorial notch, through which the brainstem continues down as a spinal cord through this foramen magnum. Now because of this tentorium cerebelli, which is covering like this, we have supratentorial compartment and infratentorial compartment. In infratentorial compartment we have this cerebellum. So this cerebellum, this is cerebellum, which is located here into infratentorial compartment. Now this is tentorium cerebelli, which is a tent shaped, and this is tentorial notch. So if you see carefully, this is tentorial notch. This is tentorial notch, which is having this free margin, and anteriorly this free margin is attached to anterior clinoid process. Now at the junction of attached and free margin, here we have trochlear nerve, which are piercing the meninges, and at the triangular area between attached and free margin, here we have oculomotor nerve, which is going down. Now this is lower down, this is falx cerebelli. This is falx cerebelli, which is attached here to the internal occipital crest. So this is separating two cerebellar hemispheres. Now in the free margin of this falx cerebri, we have inferior sagittal sinus, where falx cerebri attaches to the tentorium cerebelli. Here we have straight sinus. Now posteriorly, here this tentorium, where it attaches to the occipital sulcus, here we have transverse sinuses. So here we have transverse sinuses. Now to the attached margin over the superior petrosal aspect, here we have superior petrosal sinus. Then this inferior sagittal sinus drain into straight sinus, and they all are meeting here at the confluence of sinuses.